What's up, family? Today I'm going to show you guys how to take care of a very common area of soreness for all my desk workers here, which is the back side of the hip, down the leg, and into the low back area. A very common cause for pain in this area is overstretching of the tissues on the back side of your hip, right? Since you're in this hip flexed position for so long with pressure on these muscles back here, the tissues just tend to get irritated. Okay, so our treatment to start here is going to be just to get out of this position by standing up here. Okay, so we're just going to do a number of these sit to stands just to get the tissues warmed up here. And you can imagine as you stand up and as your hips come forward, the glutes on the back side of your hip are actually shortening. All right, so we're taking that muscle that's overstretched and we're just shortening it up a little bit, okay? So we're using this muscle as an active pump to help get us up, to get some blood flow to this area that is just overly compressed and overly stretched out throughout the day, okay? Another way that this is helpful is because when you get up out of your chair here, you're taking direct pressure off the nerve that goes down the back side of the leg, okay? And this is just a way for us to calm that area down a little bit, okay? So you're just gonna go through these sit to stands or squats for a minute or two at a time here, okay? Take your time. Again, we're just trying to get out of that sitting position and we're trying to use these muscles that just aren't being used enough, okay? If we catch this problem early enough, then it's not gonna turn into a major issue down the line. If you're just getting a little bit of soreness here and there, that's your body telling you, okay, it's time to do something right now. Don't ignore it. Don't wait for it to just go away on its own. Let's take care of it right now by just doing some of these squats here for a minute or two, okay? Perfect. So that's step number one, just to get the blood flowing. Step number two is getting a little bit more load into these tissues back here, okay? So put your left foot out in front to start. You're gonna go with a little bend in the knee, and then you're hinging forward at the waist and coming back up, okay? You can use the chair for a little balance if you need it, but you're putting most of your weight on this front leg here. You're hinging forward. As you do that, the butt goes back, and then you're coming up into this standing position again, okay? So what we're doing here is we're actually stretching the glute as we go back, but where we get the benefit is when you come up top, you're using that glute, you're engaging those muscles to get you upright again, okay? So this complaint of soreness in the low back, back of the hip, down the leg, is more of a disuse kind of injury. So what we're doing is we're reloading these tissues to get them to calm down a little bit, okay? Sometimes we get injuries from overuse. This is more of a discomfort from underuse. So we want to try to use these guys a little bit more, okay? So this is a great way for us to further load up our posterior chain, our glutes, our low back, even down the back side of the leg here. All right. We want to hit both sides, so go ahead and switch, but you can spend more time on the side that is giving you the trouble. But we don't want to just ignore the other side completely because we want to make sure both sides are staying healthy and they're both getting attention here, okay? So as you do this, it's not a big up and down motion. It's really a hinge at the waist and then come back up. If you're doing it well, you should feel a stretch in the glute as you go down. And then as you come back up, you should feel that area working, okay? So just nice and easy like that. You're hinging forward at the waist. We're loading up that glute and we're using it to control this motion here, okay? Good. So that's part number two. Part number three is just going to be a very simple dynamic hamstring stretch. Okay, so we're going backwards here, and then we're standing up, okay? So the dynamic movement here is what is gonna benefit us. It's bringing blood flow to the area. We're warming up these tissues again and using them since they're not being used when you're sitting down, okay? So just a nice, easy, dynamic hamstring stretch. We're also getting a little bit of flossing of the big sciatic nerve that goes down the back side of your leg and can contribute to some of that soreness there, okay? So this dynamic stretch here is a good way to get those tissues moving, okay? And then we'll go ahead and switch sides and make sure we hit the other side here. Excellent, just like that. Nice and easy. I'm just showing you how to do it this first time. Once you get these 3 movements down, then what you can do is just set a timer for 5 minutes, go through the sequence on your own, and then try to do that over the course of the week to make sure that you're not forgetting about this area and that you're taking care of it and getting ahead of the problem before it becomes something bigger, okay? Good, so just like that, 3 movements. If you're dealing with this pain right now, then try to do this at least once a day for the next couple days here and see if that doesn't help get rid of some of your pain. If you're not in pain right now, this is also a great proactive therapy session, a good proactive movement break to help stay ahead of this issue, because it is a common issue for anybody that has to do desk work and has to sit a lot during the day. If you found this video helpful, please like the video and subscribe to this channel so I can keep making content to help you guys stay healthy. Move simply, my friends.